Yeah, thank you very much. 6 killed, 13 others shot at a grocery store in Tucson. And since that day, in January of last year, prosecutors have been trying to get the accused shooter, Jared Loughner, punished. And it looks like that is finally going to happen. After a lot of back and forth about his mental competency, there are reports that Loughner will be in Tucson for a hearing tomorrow where he is expected to change his plea to guilty, and it would avoid a death sentence. A wife of one of the victims says she's thrilled by Loughner's expected plea change because it will give her at least a little bit of closure.
Yeah, so that brings us to the psychology part of this decision. Joining us this morning, Dr. Michael Yasinski. He is a psychologist here in the Valley, has his own practice. Good morning.
Good morning.
So how, I mean, to say that he's been taking these drugs for this long and now he's competent, how does that all work?
Well, I think it starts by, this has been drawn out a little bit longer than normal with this legal battle. Usually in cases like this, drugs can help in this case because he was diagnosed with schizophrenia, for example. There's a problem in the brain with certain chemicals in schizophrenia. It makes you have disorganized thinking, psychotic symptoms, hallucinations, etc. The drugs act on those symptoms or the parts of the brain to basically fix that chemical imbalance and then essentially get rid of those symptoms, clearing up the mind. In this case, he did not want to take the medicine, so the lawyers had to fight back and forth to force him to take medicine, and normally what takes typically 2 weeks to a month to really get someone treated, this is now dragged out for over 2 years.
Can those drugs make you like a different person, or is it just so you can understand some things?
Depends on what you're starting with. If you were really sick and had not been treated, you can essentially become very normal with the medicine, so you essentially can be a different person for a good way. They do have side effects, but in general, when you're dealing with schizophrenia, your mind's much more clear, your decision making is much more clear and rational, and all the symptoms that are bothersome tend to go away. So they're very good medicines for fixing the problems in schizophrenia.
Is it more like a sedative then? I mean, you know, again, this would be to avoid a death sentence. But we've read about some of his outbursts in court. I mean, I was reading last night where he lowered his head at one point and then came back up in court and went on an angry rant. That's why I'm asking you about the drugs. I mean, does it just make him just kind of still? No,
it brings their mind, when they're not treated in schizophrenia, and when you have a bizarre kind of behavior like that, their mind's working in a kind of an altered universe where they don't have as much control over behavior. They don't follow the same norms and regulations as what normal people do. So the drugs tend to fix the underlying problem rather than simply sedate them. So they get to the root of why they're doing it, clears them up, and then essentially, you know, they are able to act and think rationally, which competent in this case means he's able to rationally think about the decision and what he's doing with the plea.
You may not have an answer for this, I don't know if anybody does, but if he stays in prison for life, would they continue the drugs with him or just let him be?
Well, it's going to be his choice long term. The way they're able to force it is for getting him to be competent again. That's how they won that legal battle. But after this, it's really his choice long term to take the medicines unless there continues to be legal battles to force it. But in general, it's going to be up to him once he's in prison to continue on the medicine or not.
Dr. Michael Yasinski, thank you for the insight.
Thanks.
Appreciate it.